Horseshoe kidney. The discussion is at the general level. Many a patient in the OPD getting concerned by the ultrasound report, which states that they are having horseshoe kidney or fused kidney. Fused kidney. We will see what is it. Normally, a human being have two kidney, as you see in the picture. Two kidney, both the kidneys having ureter separately, which will connect to the bladder, and the bladder will pass out the urine outside through urethra. Two kidney not connected separately. In the picture you can see it clearly. Suppose if the kidney get fused, what is fused? Nothing but it get joined. It joined and form a U-shaped structure. That is why the name is horseshoe kidney. Horseshoe, we are giving the picture here. It is looking like a U. The horse, the footwear of the horse will look like a U. That is why the name is horseshoe kidney. Why it get fused? In the childhood, or even better than saying as childhood, we can say the embryologically, intrauterine, in the mother's womb, while developing the kidney tissue separate and ascend, go upwards to the normal current position. Okay, in the childhood, the body will be totally small, the development occurs and the kidney moves upwards. Because of some issue at that time, whatever may be the issue, let us discuss it afterwards. Whatever may be the issue, because of some issue, the kidney didn't separate, jointly tried to move upwards. It moved upwards. That is why the connection tissue is there. Both the kidney connected at the lower pole. It can be of various severity. Both the kidney can have its own separate ureter, or both the kidney together can have its own single ureter. Sometimes both the kidney can be on the single side, sometimes both the kidney can be on the right side or left side. A typical U-shaped thing is called as horseshoe kidney. The tissue which is connecting might be bigger in size, might be smaller in size. A small tissue. If it is bigger in size, it might not lead to the normal position, which is in the retroperitoneum. On the back side, it might not go till that side. Why? Because there is one artery which prevents it from ascending. Okay, that if it fused in the childhood, it's called as horseshoe kidney. Okay, the terminology, whatever we discussed, is fine. Is it common? Yes, the incidence is as common as 1 in 500 to 600 general population. If 500 to 600 people you are seeing, one might be having this condition, and many of them might not be aware even. Many of them might not be aware. When they will come to know, usually you are doing ultrasound for some other reason. You are doing it for some random general checkup or abdominal pain of any other etiology you are doing, you found the kidney is joined. So what is the issue? As such, horseshoe kidney rarely causes any problem. As I told, depends on the severity of the joining and other associated symptoms. Simple horseshoe kidney, where the tissue connecting both the kidney or the renal tissue, if it is thin, rarely it causes any problem. Usually it remains asymptomatic. So this is a good news. Whoever in the OPD saw the horseshoe kidney accidentally and getting some kind of apprehension, don't worry, it is normal finding. Up to 1 in 600 people similar to you are also having, don't worry. But depends on the severity of the connection tissue. If it is bigger, where it is positioned, what are all the problems which can happen, what are all incidents we have seen, what is horseshoe kidney we have seen, why it happens in the childhood, during the development it happens, after development it occurs, it won't occur. Once the kidney is formed in the adulthood, it won't go and fuse. It always occurs congenitally. Incidents, why it happens, what it is we have seen. But what are all the problems it can cause? Recurrent UTI, obstruction to the flow. The kidney is having the ureter is passing the urine to the bladder, it might get obstructed because of the poor flow. Because normally two kidneys are separate, easily the pathway is going. Whenever the anatomical structure is somewhat not in the normal position, the kidney drainage, the urine drainage might be hampered. Recurrent urinary tract infection. Urine can ascend back from the bladder. If the bladder gets full up, it is called as reflux. From the bladder, urine can ascend up. Kidney stone diseases are common. It can occur recurrently. You treat it, it can come back. Treated, it can come back. And if the tissue is not ascended properly and it is on the anterior side of the abdomen, patient might feel some kind of heavy feeling. Heaviness might be there. Once again, not to repeat but to insist, it depends on the severity and the location. Not all patient will develop. If 100 patients are there, 90% won't be knowing, or incidentally they will be knowing. They will have a normal lifespan. There won't be any difference similar to a normal kidney. Like, is there any difference? Only in the ultrasound you can find the difference. In 10% of the patient, this symptoms can happen. Recurrent UTI, infection again and again and again, abdominal pain. A trauma can injure the kidney. For example, if it is in the back side, suppose if it is on the anterior side, a blunt trauma to the abdomen can damage the renal tissue. So these are all the problems. Sometimes it gives some pressure effect on the artery, vein. As I told, depends on the location. So in the ultrasound, you have found the incidental finding. Now what next? Almost all the patient with horseshoe kidney, usually the kidney functions are normal. We have to get the kidney function test done. Usually it is normal. You can check the urine protein level and how to confirm how much it is functioning. In the blood test, if it is normal, nothing to poke more. Just leave it. It is already functioning fine. Suppose if the patient falls under the category of symptomatic horseshoe kidney, pain, developing stones again and again, then a CT scan or MRI scan might be required. If we want to assess the function of the connecting tissue, DTPS scan might be required. These are nuclear scans which will tell what is the functioning tissue which is connecting, how much it is functioning, what is the impact of this kidney on the other structure. We will get to know through the imaging. CT, MRI, DTPS scan, DMSS scan, these are things which are used. Routinely not required. Used whenever the patient warrants the investigation, we will get it done. What are the complications it can cause? As I told, sometimes hematuria. Suppose if the recurrent infection is there, the patient can land up in hematuria. And as the recurrent UTI is there, patient function might fluctuate, but it is similar to any patient with recurrent UTI, not specific to horseshoe kidney. Third one, why the horseshoe kidney happen? In some syndromes it can happen. Horseshoe kidney is associated with some kind of chromosomal problem. This at the childhood level only we will come to know. When the child develops, that time only we will come to know. It is associated with some syndromes. But once the adult during the ultrasound finding came to notice horseshoe kidney, hardly it have any much relation. What is the prognosis? Prognosis means ultrasound showing horseshoe kidney. What next? Nothing to worry. If you are an asymptomatic person, nothing to worry. Prognosis is good. Lifespan is as good as a normal human being, so nothing much to worry. What is the treatment? Treatment depends on the symptom. How big is the connecting tissue? How big is the surrounding structure affected? If the person is already asymptomatic, unlikely we will evaluate further. Only if there is symptomatic or kidney is very much lower down, it is giving pressure symptoms on the other organ, then we have to evaluate. Sometimes, very rarely, if it causes pressure symptom, probably we might have to remove the tissue if it warranted, which is causing the pressure symptom. Very rarely. As a part of discussion I have told, otherwise I might not have told, only so that the apprehension, whoever seeing this video, probably you might think, sir, what is the surgery? If asymptomatic, nothing to worry. Recurrent UTI, we will treat the UTI with antibiotics. We will give a prophylactic antibiotics. Before the symptom develop, we will give, because we expect the infection can occur. If there is a recurrent stone disease, we will give diet treatment to prevent the recurrent stone disease. If there is a reflux, urine is ascending up, then we might give some medication to prevent that. If there is an obstruction in the urinary pathway, we will give some treatment to clear the pathway. This is the treatment. So this is all regarding horseshoe kidney. And for my dear OPD patient who see the ultrasound and getting apprehension, especially those young adults who comes for medical checkup, who are supposed to join your army or police or whatsoever exam, once you complete you always come and get apprehensive. Don't worry, that is a part of your routine examination. If this finding comes, you are already medically fit, no doctor will tell you to stop uh, joining army or police because of this particular finding. It is absolutely normal. Don't worry. Further evaluation as per the profession, we will check examination. A mere finding of ultrasound showing horseshoe kidney is not a contraindication for any job. Always we will check the kidney function test. Okay. Horseshoe kidney. And one last point is as common as 1 in 500. So don't worry. This is the details you want regarding horseshoe kidney. If any further doubts, you can comment upon. We will discuss further. Bye bye.